Today, we'll reveal the top 6 foods that can worsen arthritis. We'll also uncover the real cause of joint pain and inflammation and offer the best solution for it. Arthritis is a common health issue known for causing joint problems like swelling, stiffness, and reduced movement. There are over 100 types of arthritis, but 2 main ones are osteoarthritis and rheumatoid arthritis. Osteoarthritis, the most common type, happens when the cartilage in your joints wears away over time due to regular use or injury. Rheumatoid arthritis, on the other hand, is linked to an autoimmune response that leads to joint inflammation and can impact other parts of the body. There are other forms of arthritis to be aware of. Psoriatic arthritis, which is an autoimmune condition linked to psoriasis, a skin issue with red patches and silver scales. Gout, a painful condition caused by the buildup of uric acid, often in the big toe. Fibromyalgia, a long-lasting disorder that causes muscle pain, fatigue, and tenderness around joints. While these various types of arthritis come with their own symptoms and risk factors, they all have one thing in common: inflammation is a significant factor in their development. Now, let's begin by discussing the first food that can make joint pain worse, and then we'll explore the true cause of inflammation in arthritis. Number 6. Oils and trans fats. Vegetable oils, also known as refined seed oils, are a big problem when it comes to making arthritis symptoms and inflammation worse. These oils, like corn, sunflower, safflower, and soybean oils, are commonly found in homes and restaurants. It's tough to avoid these oils because they are also present in many packaged or processed foods, such as potato chips, hot dogs, white bread, fried chicken, French fries, and salty snacks. The main issue with these oils is their high level of omega-6 fatty acids, which can become damaged through exposure to heat and light, a process known as oxidation. This makes the oils go rancid. These rancid oils significantly contribute to inflammation in your gut lining, joints, and blood vessels, making chronic pain and diseases worse. Even worse are artificial trans fats, often listed as partially hydrogenated oils on food labels. These trans fats can be found in vegetable shortening used in baked goods, microwave popcorn, margarine, fried fast foods, and non-dairy coffee creamers. To reduce inflammation, it's a good idea to replace vegetable oils with healthier options like avocado oil, macadamia oil, coconut oil, grass-fed butter, and extra virgin olive oil. Before we move on to the next food that can worsen arthritis, let's explore the root cause of joint pain. You might have heard that inflammation is the sole cause, but the truth is a bit more complex. The real root issue is an excess of fibrin around the joints, which leads to persistent inflammation and pain. So, what exactly is fibrin? It's a protein that can't dissolve and plays a role in healing wounds, forming clots, scabs, and scars. Here's how fibrin works. Whenever your body experiences an injury, even a minor one like a bump, scratch, or a sudden change in temperature, it triggers a response. First, white blood cells are sent to the affected area to fight infection, causing inflammation and swelling. Second, your body releases fibrin to create a sturdy, net-like structure that seals off the injury site and starts the healing process. This net is essential for capturing platelets and red blood cells necessary for forming blood clots. Normally, once the injury heals, fibrin breaks down, and the inflammation goes away. But in arthritis, fibrin continues to build up in the blood vessels and tissues around the joints. Excess fibrin thickens and hardens, forming scar tissue that restricts blood flow and oxygen. As a result, the healing process slows down, leading to prolonged stiffness and pain. This is precisely why pain medications become less effective over time. They don't address the root cause of the issue. Fibrin doesn't only affect the joints. As long as there's too much fibrin in your circulatory system, it hinders the delivery of red blood cells to where they're needed most. Consequently, your heart has to work harder, and your blood pressure goes up. Elevated levels of fibrin in the body increase the risk of heart disease and stroke. Before we reveal how to break down fibrin, let's explore other foods that contribute to the accumulation of fibrin and inflammation. If you find this information valuable, please like, share, and subscribe, and click on notifications to make sure you never miss a video. Number 5. Soda and sugar. Let's now talk about how soda and sugar affect arthritis. Soda, mainly because of its high refined sugar content, has been shown to make osteoarthritis worse. When you drink soda, it causes quick spikes in blood sugar and insulin levels, which ultimately lead to increased inflammation throughout the body. Furthermore, sodas and other sweetened drinks that contain high fructose corn syrup add a significant number of empty calories. These empty calories contribute to weight gain, which worsens arthritis symptoms. To fight inflammation, it's a good idea to replace sugary drinks with unsweetened tea or water. By making this simple change, you can reduce your consumption of refined sugars and provide your body with a healthier option. Number 4. Refined carbohydrates. Have you ever noticed increased joint discomfort after indulging in a substantial amount of pizza, bagels, cookies, donuts, or pasta? This happens because refined carbohydrates, which are present in these foods, rapidly break down into sugar, causing a spike in insulin levels. As a result, inflammation occurs throughout the body, similar to what happens when you consume soda. To reduce unwanted inflammation, it's a good idea to replace white bread and pasta with healthier alternatives, such as whole grain bread and sweet potatoes. Additionally, for some individuals, it may be beneficial to consider avoiding gluten, as it can be a potential trigger for inflammation. Number 3. Gluten. For individuals with celiac disease or gluten sensitivity, consuming gluten can trigger an immune response that may lead to joint pain and related symptoms. A study published in the Oxford Journal of Rheumatology found that 41% of participants with rheumatoid arthritis saw improvements in their symptoms when they followed a gluten-free diet. If you suspect you have gluten intolerance, it's advisable to eliminate all gluten-containing foods from your diet for a 2-week period. During this time, carefully observe whether your joint pain worsens or improves. After the elimination period, gradually reintroduce gluten and monitor how your body responds. Gluten is a protein found in wheat, barley, and rye. By paying close attention to your body's reactions, you can gain insights into whether gluten plays a role in exacerbating your joint pain. Number 2. Charboiled and blackened foods. If you have arthritis, it's best to avoid high-temperature cooking methods like broiling, frying, and grilling. These cooking techniques create advanced glycation end products, AGEs, which can increase inflammation and make joint pain worse. To minimize your intake of these inflammatory compounds, it's recommended to stay away from foods like grilled meats and fried potatoes. Number 1. Nightshade vegetables. For individuals with osteoarthritis, rheumatoid arthritis, or other joint problems like gout, it might be helpful to remove nightshade vegetables such as tomatoes, eggplant, potatoes, and peppers from their diets. Nightshades contain alkaloids that have the potential to contribute to the buildup of calcium deposits in tendons, ligaments, cartilage, and joints. This accumulation can lead to inflammation and pain. Now let's delve into how we can address the root cause of arthritis, which revolves around proteolytic enzymes. The key point to remember is that proteolytic enzymes have exceptional anti-inflammatory properties and are essential for a pain-free life. These enzymes, also called proteases, are a type of systemic enzyme that breaks down proteins into smaller, more easily digestible units that the body can use effectively. One of the main roles of proteolytic enzymes is to break down excessive fibrin found in the circulatory system and connective tissues, including the muscles. These enzymes help eliminate fibrin and scar tissue, which allows for better oxygenation and the delivery of nutrient-rich blood to the tissues. This process assists in removing metabolic waste that contributes to pain and inflammation. While the body naturally produces proteolytic enzymes in the pancreas, their production significantly decreases after the age of 27. Therefore, it's essential to obtain them from dietary sources or through dietary supplements. 2 excellent food sources of proteolytic enzymes are pineapple and papaya. Bromelain from pineapple and papain from papaya have shown effectiveness in reducing pain, swelling, and joint stiffness in individuals with arthritis. You can find a link to a pineapple joint elixir recipe below. In addition to pineapple and papaya, other foods rich in proteolytic enzymes include kiwi fruit, figs, ginger, asparagus, and fermented foods such as sauerkraut, yogurt, kefir, and miso. Proteolytic enzymes offer more than just inflammation and pain relief. They also have significant roles in relieving muscle soreness, speeding up wound healing, regulating blood pressure, boosting the immune system, and even combating viruses. In conclusion, if you're looking to alleviate arthritis pain, it's worth considering the inclusion of pineapple and papaya in your diet. However, it's important to recognize that relying solely on food may not be sufficient to effectively raise your enzyme levels and provide relief from pain. Thank you for watching this video. If you found the information valuable, we kindly ask you to share it with your loved ones. Stay tuned for more upcoming videos.